So this next case is a patient who came in for a breast biopsy because her mammogram was abnormal. She had a family history of breast cancer, and she recently had had an abnormality. She had had some pain in her breast. So she was very concerned. Could this be a breast cancer?
You just kind of get that sick feeling when you're thinking about it, but it's like, don't get ahead of yourself. We're gonna have the next couple tests and we'll see where we're at.
Pathology is an integral part of surgery. It guides everything we do, from telling us when we've achieved adequate margins around a lesion to what the prognosis for that lesion ultimately is, or if it's benign in the best case.
The most important job that we have as pathologists is to provide a specific diagnosis. Is it going to spread? Is it going to be localized? Is it a disease that will benefit from doing additional testing, such as molecular testing? Those are all the questions that are going through our minds when we're looking at a piece of tissue.
Often in surgery, we want a real-time feedback as to whether we have fully excised a lesion, be it benign or malignant. And so often, for instance, in a breast biopsy case, I will actually take the specimen down to the pathologist myself and watch them process it and discuss with them in real time what their concerns may or may not be.
It was a flood of emotions. It was like Christmas come early, and then when they told me that it was clear and there was nothing to really worry about, it was like a lot of anxiety was kind of lifted too, like, whew, thank goodness.
So this is your pathology report, and this is the final diagnosis section. The most important thing in this line is the word benign.
The one-on-one time is really important after you've had such a high anxiety level to bring it down to normal.
And with it being a cyst, is it okay to leave it there for periods of time?
It was a huge sigh of relief that came out of me. You know, it could have gone the other way. And, you know, I was one of the lucky ones.
Some people call us the doctor's doctor. We're specialists who consult, so we are an integral part of the team. We're behind the scenes, but we help the surgeons when they remove tissue to define what the tissue is, and we also help the primary care doctors by giving them information that they need to treat the patients.